I recently had the privilege of hosting the 2025 Priority Digital Health Challenge, an initiative that was led by Cogniss and supported by AWS, the Validitron, the AIDH, the Digital Health CRC, NextGen, and of course, Talking HealthTech. The focus of this challenge was around solving meaningful problems that affect underserved communities. And these are the kind of issues that often get overlooked, not because they don't matter, but because they don't fit into a traditional business model. We saw 5 incredible teams pitch ideas grounded in deep expertise, lived experience, and real desire to make change. And the caliber of purpose, thinking, and execution was seriously impressive. So in this episode of Talking HealthTech, I'm bringing you into that experience. You'll hear from key people behind the challenge, including the founder of Cogniss, Leon Young, plus judges like Leon and Adjunct Professor Annette Schmiede, and of course, the winning innovators, Dr. Sarah Hanieh and Professor Caroline Donovan. Collaboration starts with a conversation, Team HealthTech. Let's make it happen. So we kick things off in this episode with Leon to set the scene, to share the origins of the Priority Digital Health Challenge, what makes it different from other digital health programs, and why it's gaining international momentum. Let's get stuck into it. Leon, can you tell me about the 2025 challenge and the key highlights from it?
Yeah, sure, Pete. It was very exciting running the Priority Population Digital Health Challenge this year. It's the second year we've run it. The background as to why we started this last year is that Cogniss's mission is very much about helping the best health experts create targeted digital health solutions that may not otherwise exist, and then helping get those into health systems and getting them distributed. And what we realized is with all the different programs and people that we partner with, there's still not a lot of avenues for tapping into people who might have great expertise and knowledge about particular niche health issues and priority populations. And priority populations in our term is really those underserved populations that health systems know they need to do better with. So that was kind of the genesis of the competition. Last year we got great range of entries from around the world, supported a couple of great products coming to life. And that really informed what we wanted to do this year. And we just ran with the momentum off last year, and again blown away by the range of entries locally and from around the world, and the different emerging health issues that we're seeing people want to tackle with digital health products.
And I know from experience, like you can have a vision for these types of initiatives or programs or whatever, like anything that you do, and then you run it through its course and you get applications and people kind of perceive it in their own ways as well. And then you kind of evolve with the need. I'd love to learn, or I'd love to hear your reflections on how you've seen that challenge evolve a little bit more, and then what that might mean for future iterations of what you do.
Yeah, it was really interesting last year, just the momentum that the competition got. You know, we promoted it just in Australia basically, but it kind of went viral, and we got entries from every populated continent, as we did this year. And it was interesting to see the profile of the people who were coming into the competition. They were people with deep scientific knowledge on the area that they wanted to address, and usually they're people with some sort of lived experience and close to the communities that they want to help. We've seen through both competitions that you very much start to get cohorts of people coming through addressing sort of clusters of issues that sit together, whether that's things around unintended bias in the system, which might be related to gender, might be related to race, where there isn't sufficient funding, etc., to address particular communities as well. And what we've started to realize is that, one, there are so many solutions that we want to see brought to life, and two, that in order to make it easier to get these solutions into health systems and ultimately into the hands of people that need them, we need to focus on bringing those cohorts of products together. very hard for health systems to acquire one-off patient-facing digital health products, almost impossible unless they have a very big user base. And so what we're moving to is a model in the future where we're going to support, under the Ripple brand, more of these competitions being run, focused on different areas, and run around the world, basically looking at different priority populations and how to get cohorts of products put together and created, support them through research, support them through everything they need to think about in terms of health economics to get their products to market, and try and build more of that pathway to market. I think a separate thing that has really been brought home for me too is that because these products are being created by people with expertise who care about the problems that they have, these people are not typically entrepreneurs. They don't want to do a startup. They're not people who are used to going and doing pitching competitions and things like that. And we want the best people to create the best products. We don't expect these people to be great business people or to be building some sort of empire around the product that they're building. That's not what they want to do. And so it was really important in the competition this year that we tried to de-stress the process for everyone. And one of the things that was different in the judging is that we actually got people to shoot videos beforehand doing their pitch. We don't want to stick them on a stage. We don't want to create a stressful situation for these people. They're not future CEOs, they're health experts. And so removing some of that sort of startup culture and making it a bit friendly, a bit more inclusive seemed the natural thing to do. These products are about inclusivity, so the process should be inclusive as well.
Yeah, so good. The good thing too, I guess you've got a little bit of experience under the belt, and you it's one thing for someone to win the challenge, and then and often you hear about these challenges, you don't actually hear about what happened to that. I'd love to hear any reflections you've had on, say, previous, from last year's competition, the apps that were built out of that and how they've progressed.
Yeah, so we had two fantastic winners last year. The first one that was very high profile internationally is a product called Melanatal, created by Ruby Jackson, who is a midwife in the NHS in the UK. She was actually a student midwife at the time that she won the competition, rather. And her product is to address a massive unintended bias that exists in health systems around the world. And this is in relation to the perinatal process. And essentially, unintended bias means that even in systems like the NHS, which has amongst the best outcomes for maternal health in the world, women with black and brown skin are significantly more likely to die during that process. In fact, women with black skin are nearly 4 times more likely to die than white women, simply because doctors don't necessarily know what to check for, or aren't in a cultural frame of mind to think about the extra things that they need to check for on dark skin, and a variety of fairly complex issues that really come about through the history of medical education. And so Ruby created an app that serves 2 different audiences. One of them is clinical education, so for healthcare professionals inside systems to know the differences in terms of what they should be looking for with women and babies with black and brown skin, but also for mothers as a patient advocacy tool. And I think this is really important. When we come to addressing issues around priority populations, there's only so much that we can do inside the health system. You can't change cultures overnight. Even with the best tools, you can't educate everyone and then ensure that the behavior change is going to happen. So we have to equip patients to be able to be self-advocates, basically, when they go through that process. Now, the problem at the moment is that when patients try and do that, their sources of information very variable. They tend to be what they've seen on TikTok, what Facebook group they belong to, a random consumer app they found in the App Store that may not have any good evidence base behind it. And so as a result of that, even when their questions and their advocacy is valid, doctors may not take take the points that the patient is raising seriously. So these products that are evidence-based and that a patient can bring with them and show to their healthcare professional become really powerful as tools to make sure that healthcare professional has done all they need to do. The other winner was Belinda Langer at Flinders University with a product called Journey to Recovery, which is a stroke rehabilitation program. And basically really wanting an app that was discreet, that patients could have to take them through that process regardless of how they're engaged in the health system. And what I think we're starting to see with both of these apps is that they're getting great evidence bases, they're getting great responses in terms of the level of interest, but there is this problem with how they become procured inside health systems, how they get distributed. And if we take the melanatal example, that is one that is dealing with a problem that's very top of mind. It's had a lot of media coverage in the UK and worldwide. When Ruby goes out and talks to head midwives in NHS trusts and things like that, everyone loves the product. Everyone wants the product to be out there for healthcare professionals and for mothers and to be easily accessible. The problem is, who is the buyer? Head midwives, just like other clinicians that are aware of these needs in health systems, don't have the means to procure these products. They don't have the pathway to procure them. They don't have the authority. They don't have the money. And there's all sorts of problems with how these products get into systems, how they need to be integrated. And that's why, as a company, we're very much focused on a platform-level solution that opens the gateway to lots of these products. But what it means for the competition is that I think the competition has shown we can support people through the building and evidence collection phase. And now what we need to do is look at how we support them through the distribution phase, basically, making sure that they can get those products out into the hands of people that need them.
One of this year's winning entries for the Priority Digital Health Challenge was from Dr. Sarah Hanieh, a paediatrician and public health researcher who's tackling a quietly massive issue of nutrition literacy in refugee and migrant communities. Her solution, Project Shine, is a co-designed and culturally relevant tool to support healthier food choices and reduce chronic disease. Let's hear from Sarah.
My name is Dr. Sarah Hanieh. I trained as a paediatrician, currently working as a senior research fellow at the Doherty Institute at the University of Melbourne in the area of public health. And the problem area that I'm addressing is nutrition literacy among refugee and migrant communities and the rising rates of chronic disease, the burden of chronic disease in these communities, particularly things like heart disease, diabetes, high blood pressure. And we find that a lot of, with the refugee and migrant communities, and actually for all of us, the labels that are written on foods are so complicated. Like, it's very hard to understand what do they actually mean. They're so small, and how does that relate to you personally? Also, they're not really culturally adapted. So most of them are written in English, and then also they don't often sort of speak to you in the way that you might be used to being spoken to in terms of your culture. So all those things, those barriers, are really contributing to a rising rate of chronic disease in these communities, and these barriers to nutrition literacy is something that I'm really passionate about solving.
And tell me more about the application and how you see that will help address that particular specific issue.
Yeah, so the application is, I've called it Project Shine, which stands for Smart, Healthy, Interactive Nutrition Education. And it's all about, meeting people where they are at and doing it specifically for communities, being co-designed. So what I want to do is to co-design this app with specific communities and look at ways of telling the story about nutrition in a more audio-visual way. So, for example, the journey of sugar through the body. What actually happens when you have a sip of Coca-Cola? What happens, or a sip of a soft drink? What happens to that sugar when it goes inside your body? How does it affect your body? And what does that mean for you personally? But I want to be able to tell that story not only through translating it through language, but also visually in ways that people can relate to and understand from their point of view. So really making it very targeted and specific for specific communities. I would also want to include foods that are relevant to specific communities, because often apps are not, they're not, a lot of them aren't culturally adapted. So you don't see foods that are there that you would normally buy or cook with. So I want to have things like healthy food swaps that you can relate to, potentially like nudges to remind you when you go shopping about things, and just being able to translate that information into a way that's really easy, simple to understand, in a way that people will enjoy learning about.
Yeah. And I guess let's say, we get that right, and the learning is there, and the information is more accessible. That's interesting, but it's in the end, everything is about like the impact it has, right?
Yeah.
So what do you hope that the impact is that in utilizing this solution that it'll have across the health system?
Yeah, definitely. Like the impact is so important, and we really want to try and make real world impact. So the goal would be to improve nutrition literacy in terms of people being able to go into a supermarket or somewhere and be able to know, yes, this food has high sugar, or this is not so healthy. Here's a healthier alternative that I can quickly use or swap out, and to reduce potentially the amount of high sugar foods or unhealthy foods that are being purchased, and increase the amount of healthier foods that are being purchased, and in the long term reduce the burden of chronic disease in these communities, like diabetes or heart disease. But another impact that I really want to have is to help people feel seen, and by creating this app that's specific for communities, I want people to feel represented and to be seen in their way, in that people that are often left out of these digital health apps. So that's another really big impact that I'm hoping to have.
The next winning solution from the Priority Digital Health Challenge came from Professor Caroline Donovan, a clinical psychologist with years of research behind a program called Lights Out, focused on helping parents navigate sleep challenges with children. Her team is now turning that evidence-backed program into a consumer-friendly app, something that's desperately needed in this noisy space full of untested solutions. Here's our discussion.
I am Professor Caroline Donovan. I'm from Griffith University, the School of Applied Psychology and the Centre for Mental Health. Out there, I do a lot of research into paediatrics, so mostly paediatric anxiety and sleep problems, but also depression and body image issues. So I teach as well into our postgraduate program, and I'm the Deputy Head of School Research at Griffith in the School of Applied Psychology as well.
Super, thank you. And tell me about your journey with the Priority Digital Health Challenge.
Yeah, so when we saw that challenge, we were pretty excited. We've got a Lights Out program that we've been. Lights Out program is a program for child sleep problems, so it's parent focused, but it's developed to teach parents how to deal with their child's sleep problems. We've been developing that for a number of years now, and we've got face-to-face versions and video conference versions. And we developed an online version to try to get at that sort of problem with accessibility and making sure that everybody has access to it. But what we found was that even though it worked really well, it did improve the kids' sleep and also their behaviour problems and anxiety. But the parents of these young kids, so these were the ones aged 3 to 6 years, they didn't really like the format very much. They didn't like sitting down at a computer and working through sessions when their life's quite fragmented looking after young children. So they asked us and suggested to us that we develop an app version. Now, we're from a university, so we don't have money at our disposal to just do such a thing. So when this Cogniss, this Priority Digital Health Challenge came out, we thought, this would be a perfect opportunity for us to develop the older child one first. We've got a grant application in for the younger child one right now, with both being developed on Cogniss, hopefully. So this was just a great opportunity for us to get the expertise from Cogniss and to develop a really helpful app, an evidence-based app that we know will work to help child sleep issues.
Yeah. And look, I love the nature of all of these solutions is they're evidence-backed products that need to see the light of day. Tell me a little bit more about that evidence and the work that's been done that's going to then inform the product.
Yeah, thanks. So the original project, which was conducted quite some time ago now, actually, was done with the face-to-face version. And we conducted a full randomized controlled trial with 146 parents. And we found that the program not only improved the child's sleep, but also improved their anxiety and the behavior problems as well. And we were able to show that it was the changes in the child's sleep that actually led to the changes in those other issues too. And it also served to prevent anxiety. So in the kids who didn't have anxiety when the program started, a lot fewer of them who were in the treatment group went on to develop anxiety than they did in the control group. So it seemed to have this kind of preventative effect on anxiety more longer term as well. So then one of my PhD students did a video conference version, another randomized controlled trial, a smaller one this time, with parents of young children, and looked at a 3-session video conference version of Lights Out. And again, found that really good for sleep, for child sleep, but also that it improved the child's anxiety levels, nighttime fears, and also parenting, the way the parents parented their children. So that was really good. And then finally, we developed the online one. The big randomized controlled trial for that is ongoing. But we did do an open trial to start with, and we found again that it improves the sleep and anxiety and behavior problems, but also reduced parental anxiety and increased parental self-efficacy as well. So we've got a lot of evidence to suggest that this thing works, and not only works for sleep, but seems to have a bit of a transdiagnostic effect on other child and parent outcomes. There's a lot of evidence to suggest that the program works. Now we just have to get it into a format that parents like and will actually use and uptake more easily. And that would be an app.
Yeah, 100%. And look, I guess, where, I mean, I love as a father of 3 children, and bedtime still gives me, cold sweats, but that's okay. And certainly not alone, but super grateful for that. But there's no shortage of applications or claims made on the internet that this thing can help with sleep. How are you finding that kind of making sure this stays above and beyond as like this research and evidence-backed solution that then would, I guess, sit on an app store and then be available for any consumer to download still, which is then the wild west of other random solutions that exist out in the internet?
That is true. So there's lots and lots of different sleep apps. Most of them are just, and they can assist with sleep in that they might be, white noise or relaxing music or something, which can form part of what we do with Lights Out as well. But I guess Lights Out's got a lot more strategies. It's based on cognitive behavior therapy, where we look at the underpinnings of all these sleep problems and try to get at the root of what's going on and then treat that so that the sleep will improve. And it empowers parents as well. So it's a full training. It's a lot more than just a simple sleep aid. It's an actual treatment program. So that's how we hope to kind of market it, but also Lights Out's been getting, certainly in Queensland at least, because we've been around for a little while, people do know about it, and we're trying to get it through places like Queensland Health. So that hopefully GPs and other psychologists and whatnot, with our links through the Australian Sleep Association, and we can market it that way through professionals, so that professionals can then refer parents to that app, knowing that it's actually evidence-based, because it's really hard for parents. They're just confronted with a gazillion apps when they hit sleep problems into the search engine, and how do they know? So hopefully if they can be referred to the app by mental health and physical health professionals, then they can be a little bit more reassured that it's actually evidence-based and will work.
To close out this episode on the Priority Digital Health Challenge, I brought back Leon Young and was joined by Adjunct Professor Annette Schmiede to reflect on the judging process and the bigger picture from the program. We talked about how research translation, procurement hurdles, and platform level thinking, they're all connected, and why programs like this can help close the gap between innovation and real-world outcomes. Let's dive into the discussion. Annette, I'd love to hear from you as one of the many esteemed judges from the challenge. What was the experience like as a judge, and what insights did you take away from the event?
Well, first of all, I was absolutely delighted to be asked to do this. There was quite a bit of homework, which was great because I was able to do a deep dive into some areas that I probably didn't know a huge amount about. And I guess for me, what really stood out was the absolute sheer diversity of the entrants into the challenge, the finalists. Not just their backgrounds, but in the actual problems that they chose to solve. As we know, there was a strong emphasis on equity and access, and perhaps populations that don't get as well served for a whole lots of reasons, as we know, and particularly many of them were built around issues dealing with women at various stages of their lives. And what also stood out was every one of the entrants or the finalists it was clear that they were deeply embedded in their communities. So they really had a really good understanding of what the issues were and what the problems were that needed to be solved, or they themselves also had personal lived experience that were driving some of their ideas about how they might be solved. So that just gave it such a huge sense of humanity about it, that we were really dealing with real people who had real problems, and we were going to come up with solutions that were actually going to go straight to helping them in very practical ways. Of course, with a great sort of emphasis on digital technology to really drive that. So, bringing that into a sort of a 21st century environment. Even though some of these problems have been long, they're been going on for centuries, but we're now in a position to really start to really hone in and deliver solutions at a very personal level. So, as I said, also there was a very strong emphasis on equity and accessibility and empowerment, all of the really, I guess, important elements that you can have a solution, but unless you can bring about that, what I call that personal change at the human level, I mean, sometimes you're not going to get the outcomes and impacts that you'd like to see. But I also think that we're also dealing with a very much a generational shift in how we design digital health tools, right? This is really human-centered design at its best.
Yeah, so good. You're right. Often technology solutions or innovations that get the attention and funding and resources and everything that are needed, often by design need to be ones that can be done on a grand scale, but sometimes those don't address real problems that communities may have, or at an individual level that it's difficult to find a platform or a way in order to do that. So that's great to hear that as a reflection. What about yourself, Leon? What did you take from it?
Yeah, very similar. And I think what you're touching on, Peter, there is really the crystallization of that. I guess the gap between the promise and what's been delivered to date with digital health. One of the things that I found so interesting in the judging process now in the second year, and I should say I get to be involved in the early stage of the process too, which is the early evaluation and helping decide what gets through to the finals. So I see the sort of full breadth of what comes through, is that the types of people who bring these solutions forward in the competition tend to be, as Annette said, people with lived experience or very close to that lived experience in their family or in their community, who also have deep subject matter expertise. So they're not just people who have seen a problem, experienced a problem, and want to solve that. They've experienced it, but they also work in the area. They also come from a research background, a scientific background, so they have the applied knowledge to do that. And they're the people we really want to empower to create these solutions. Now, when you look at the broader digital health world and the channels that already exist for people to bring products to market, as you said, Pete, they'll be very focused on the things that have mass market direct scale immediately. And actually, so much of the conversation, if you go back to the early conversation about digital health, was how can we use this to plug the gaps? How can we use this to support all the people who aren't getting sufficient support through traditional channels? and bringing forward, I think, both the technical models and the business models to support those things getting to market is really key. And this has kind of been for us the first stage of unlocking that. It's also really interesting, and Annette touched on this, to see the kind of cohorts that come through. There are recurring themes like parenting, women's health, health equity in relation to race, and conditions that get overlooked. And just you get a sense of where the system isn't serving people well at the moment. And I'm talking about the system globally. I'm not criticizing any one system. It's just the nature of how we've done healthcare in the past hasn't allowed us to accommodate these niche groups. But actually, these niche groups, often when you look at them, are huge. I mean, women's health is 51% of the population. It's not a niche. And yet, as a and a need and a subject matter being addressed, it's been chronically overlooked generally in the system. And there's so much issue, particularly with women's health, when you look at bias that inadvertently exists in the system, that will take a long time to overcome. It can't, no one can wave a wand and suddenly re-educate everyone working in the system and change the structures that exist in the system. But this is where digital can really, really help, because it can reach those people and provide them what they need when they need it.
And look, you touched on, Leon, I guess the way that healthcare is structured, or the way that we do things in digital health. And it made me think, Annette, I know your background in your world, I guess, is that that important need for evidence-based solutions and research to exist in healthcare. But we know that a lot of research happens and then it kind of doesn't get to the next stage of, being actually applied in the real world. I'd love to hear from your side in relation to, I guess, the challenge that we face these days in digital health around research translation. It's something that's been a challenge for a long time, but where do you see us going to try and bridge some of those gaps?
You're absolutely right, Peter. I mean, and that's the value of the Digital Health CRC model, in that we are here to accelerate research, translation, and implementation. And this process that we've just been through with the challenge is a great example of that, where you really, the research is bubbling up from, the real world experiences. And then, what we have to also wrap around it is the evidence to support the approach, and then the evaluation of it. And I mean, what really also struck me, a lot of the all of the finalists, had clearly demonstrated and come out of a background of, the research had been done to support the approach that was being taken, and why the approach had the opportunity to have what I'd call that real world impact. So, getting back to your question, what I would say, if you really, want to see that research translation, I mean, what we really want to see then is creating and sustaining real world impact. And that real world impact, I mean, we've seen the value through these entrants. A lot of them had a very clear grounding in populations, right, that are not always all that well served. So, that's really an important element of what the challenge has been able to do, is to provide a pathway for some of those populations to be served. I mean, the interesting thing, and Leon, just talked a little bit about this, women weren't actually able to participate in clinical trials in the US until the 1990s, right? Yeah. So, we had a whole lot of evidence coming out of clinical trials that didn't actually have any women in those trials, right? So, here is now an attempt to say, okay, let's get really serious about, what are those areas of women's health that are deserving of more investment in terms of research And then how do we actually take that research and how do we deliver it to have real world impact on those populations, right? So, from where I sit within the Digital Health CRC is, it's really important that we are creating that evidence base, but the evidence base is just one element of how you get, a service or a product or a change in policy. How do you actually get that to the people who need it and bring about the changes that are going to create the impact that we want to see? But the other thing is, out of this approach, is that, particularly surfacing fresh ideas and perspectives from diverse groups and voices. I think that's a critical area that we also need to be conscious of. And once again, I think this has been a great way of being able to do that. So, I guess all of the finalists and the ultimate winners have, the potential to bring about that impact, as I said, at a population level, at an individual level, and at a clinical and health system level, right? Because that's ultimately, unless we can bring about all of the changes in the whole chain, you're not really going to get the impact that we really want to see.
Yeah. I feel like a platform or an initiative like the Challenge was a great example of how these types of innovation initiatives can try and build some of that momentum with those additional elements kind of in play. But sometimes when these ideas or the research and the work isn't surfaced or in the front of mind, then often they don't even get the airtime they need to grow, etc. Thinking about all those challenges you mentioned, though, Annette, they're not ones that are, like you say, it's been around for a long time, but also they're a global, a globally recognized issue. What do you think the impact will be, or the importance around innovation initiatives like the Challenge, if they're scaled out nationally and internationally, how they can help close that gap between research and real world outcomes?
Well, I think they democratise, right, the access to the opportunity to see health technology develop to address some of those issues, right? And I think, what was also clear in the way the Challenge was, developed is what also surfaced was some very sound behavioural science and co-design principles that were embedded in the various applications and the areas that were being focused on in the group of finalists, right? So it's democratizing and it's opening up an opportunity for those voices to be heard who traditionally have not been part of the mainstream and have the focus on what their issues might be and tailor solutions that actually have the ability to have that impact that is necessary if we're going to see the changes, whether it be in areas like, pregnancy, areas like nutrition for, disadvantaged populations, the breast care finalist, and, the behavioural one around sleep. I mean, there's 250,000 babies born in Australia every year, right? And here we finally have an application that speaks to the trauma and the frustration people have with small children who won't sleep, right? Yeah. Very practical, been around for a long time, and how much focus has there been in the traditional sort of research space? So, as I said, a great way of opening up to areas that have traditionally not really been able to get their voices heard.
And that is, I just want to touch on that as a really great example of where the long-term return on investment is there for the health system. Addressing issues in the early years sets those children up for success in a healthy life. But in that particular case, you're also addressing the health issues of the parent, who otherwise would be suffering from lack of sleep, therefore more likely to have negative mental health events, to more likely to have all types of sort of negative long-term health outcomes as a result of that. And often there's too much thought about simply treating conditions rather than investing in the long-term health of the population.
And we're not short of random apps on devices that claim to be able to address issues, and they, like anything in like any not vulnerable, but people needing help kind of communities, that you're looking for any solution. And unfortunately, the way things work often is that it doesn't need to be the most evidence-based and effective solution that becomes popular. It's the one that made the most amount of noise. So the more noise we can make about these solutions, the better. Leon, lastly, to close it out, anything else from you about, like, thinking about if we were to be able to scale out these types of initiatives at a broader level here in Australia and across the world, where do you really see that impact?
Well, we've got concrete plans around how we're going to do that. So what we saw last year was this emergence of different cohorts of I guess problems and different solutions looking at those broader issues. And we know that when it comes to accessibility of these types of solutions, it varies enormously globally. How it fits in with health systems globally will vary significantly. And so that's why we're working with AWS on launching this program called Ripple. And what Ripple is, it's at some point probably its own entity, and it's going to run competitions focused on geographies and different areas of need. And so there will be a calendar of events through the year. And what we want to do there is also bring in philanthropic organizations so that we can do a bit more than just sponsor one or two people to create an app. We can sponsor cohorts in particular areas that can be solving particular problems, and we can hopefully be helping provide the funding for research, real-world evidence collection, and doing the health economics piece on how you get a particular product into the hands of the people who need it, because that's still the big gap and the big issue to solve. And very happy to say that we're formally launching that brand soon, and we are launching the first of the Ripple challenges out of the UK with the NHS, and it will be focused on women's health. It will be an international competition, but with NHS connections, so that we can hopefully see products that are built through that go-to-market very quickly within the NHS. But we will be looking for solutions that are anything women's health related globally, and hopefully supporting a cohort of those apps to be created rather than just one or two. So, watch this space, and more information will become available on that in the future.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.